Infectious diseases are caused by pathogenic microorganisms such as bacteria, viruses, fungi, or parasites. These diseases can spread, directly or indirectly, from one person to another or through vectors like insects and animals. Infectious diseases have existed since ancient times, playing a critical role in shaping human history and even altering the course of civilizations. Infectious diseases can range from mild illnesses, like the common cold, to severe and life-threatening conditions, such as HIV, AIDS, tuberculosis, and COVID-19. Understanding the causes, transmission methods, symptoms, and prevention strategies is key to controlling their spread and mitigating their impact. Infectious diseases are categorized based on the type of pathogen responsible for causing them. Here are the main types. Bacteria are single-celled microorganisms. While many bacteria are harmless or beneficial, some can cause diseases such as strep throat, tuberculosis, and urinary tract infections. These infections are often treated with antibiotics, though antibiotic resistance is becoming a major concern. Viruses are much smaller than bacteria and require a host to reproduce. They can infect all life forms, including humans, animals, and plants. Common viral infections include the flu, HIV, and COVID-19. Treatments for viral infections vary but often involve antiviral drugs or vaccines. Fungi include yeasts and molds. Fungal infections can affect the skin, lungs, or other organs, and are more common in individuals with weakened immune systems. Conditions like athlete's foot, ringworm, and fungal meningitis are examples. Parasites are organisms that live on or inside a host, depending on the host for survival. Parasitic diseases such as malaria, caused by the Plasmodium parasite, and giardiasis, caused by the Giardia parasite, can spread through contaminated water, food, or vectors like mosquitoes. Infectious diseases spread through various pathways. This occurs through person-to-person contact, like touching, kissing, or sexual contact. Diseases like herpes and gonorrhea spread this way. Pathogens can linger on surfaces and objects like doorknobs, phones, or keyboards, and individuals can contract the disease by touching these surfaces and then touching their face, mouth, or eyes. Influenza and the common cold can spread through this mode. When an infected person coughs or sneezes, respiratory droplets can carry pathogens into the air. Close contact with someone who is sneezing or coughing can lead to the transmission of diseases such as COVID-19 or tuberculosis. Some pathogens can remain suspended in the air for extended periods and spread through inhalation. Examples include tuberculosis and chickenpox. Diseases spread through vectors like mosquitoes, ticks, and fleas. Examples include malaria, mosquitoes, and Lyme disease, ticks. Contaminated food and water can lead to diseases like cholera, hepatitis A, and E. coli infections. The symptoms of infectious diseases can vary widely depending on the pathogen and the part of the body affected. Common symptoms include fever, fatigue, diarrhea, coughing or sneezing, body aches, nausea or vomiting, rash or skin irritation. Some diseases may present with more specific symptoms. For example, tuberculosis often causes a persistent cough with blood, while malaria may cause recurring fevers and chills. Diagnosing infectious diseases often requires laboratory tests to identify the specific pathogen. These tests may include blood tests to detect antibodies or pathogens, imaging studies, X-rays, CT scans, to check for internal infections, stool or urine tests to detect infections in the digestive or urinary systems, tissue samples for fungal infections or cancers caused by infections. Treatments for infectious diseases depend on the cause. For bacterial infections. For viral infections, though not all viral infections have treatments. For fungal infections. For parasitic infections. The growing issue of antimicrobial resistance has complicated the treatment of many infectious diseases. When bacteria, viruses, fungi, or parasites evolve resistance to medications, standard treatments become less effective. This problem emphasizes the importance of careful use of antibiotics and the need for new therapies. Preventing infectious diseases requires both individual and public health strategies, one of the most effective tools in preventing diseases. Vaccines train the immune system to recognize and fight pathogens without causing the disease itself. Vaccines for diseases like measles, mumps, rubella, and COVID-19 have saved millions of lives. Simple practices like regular hand washing, covering the mouth and nose when sneezing or coughing, and maintaining personal cleanliness can significantly reduce disease transmission. Properly cooking food, avoiding contaminated water, and ensuring good sanitation can prevent diseases like cholera, hepatitis A, and E. coli. Using insect repellent, sleeping under mosquito nets, and eliminating standing water can reduce the risk of vector-borne diseases. During outbreaks, isolating infected individuals can help stop the spread of diseases like COVID-19, Ebola, and tuberculosis. Public health initiatives play a vital role in controlling infectious diseases. Governments and organizations such as the World Health Organization, WHO, work to monitor outbreaks, provide vaccinations, and educate the public about disease prevention. In the event of a global pandemic, such as COVID-19, these agencies coordinate international responses, develop containment strategies, and ensure the distribution of critical supplies. Public health measures include surveillance to track the spread of diseases, quarantine and travel restrictions during outbreaks, promotion of vaccination campaigns, distribution of preventive medications, such as antimalarials, education campaigns on hygiene and safe health practices. Emerging infectious diseases, EIDs, are those that have recently increased in incidence or have the potential to increase in the near future. These can be new pathogens, like the novel coronavirus, or existing diseases that are spreading to new regions due to factors such as climate change, urbanization, and globalization. Some EIDs include caused by the SARS-CoV-2 virus. This pandemic affected nearly every aspect of life across the globe and resulted in millions of deaths. Spread by mosquitoes, Zika caused a widespread outbreak in 2015-2016, particularly in the Americas, and is linked to birth defects. Known for its severe outbreaks in Africa, the Ebola virus causes hemorrhagic fever and has a high fatality rate. Preventing EIDs requires global cooperation in surveillance, research, and quick response strategies. Infectious diseases have shaped human history and continue to pose challenges. While modern medicine has significantly reduced the death toll from these diseases, factors like antibiotic resistance, urbanization, and climate change are leading to the resurgence of old diseases and the emergence of new ones. Ongoing research, effective public health strategies, and individual practices like vaccination and hygiene will continue to be essential in managing and preventing the spread of infectious diseases. Public awareness and a coordinated global response are crucial to overcoming the challenges posed by these diseases and protecting public health for future generations. Infectious diseases remain a significant public health challenge despite centuries of medical advancements. These diseases, caused by a wide range of microorganisms, bacteria, viruses, fungi, and parasites, can affect anyone, anywhere. They have shaped human history, decimating populations and forcing the development of medical and scientific breakthroughs. However, the story of infectious diseases is far from over. The battle against infectious diseases involves both individual actions and collective, global efforts. Vaccination, proper hygiene, safe food and water practices, and vector control are some of the most effective tools in preventing the spread of these diseases. Public health campaigns continue to educate communities on the importance of these preventive measures, while global organizations like the World Health Organization, WHO, play a crucial role in coordinating responses to outbreaks and pandemics. The ongoing threat of antibiotic resistance has brought a renewed sense of urgency to this battle. Misuse and overuse of antibiotics have led to the emergence of drug-resistant bacteria, making once treatable infections more difficult to manage. This challenge highlights the importance of developing new treatments, antibiotics, and vaccines, as well as promoting the responsible use of existing medications. Emerging infectious diseases, such as COVID-19, Zika virus, and Ebola, remind us that the landscape of infectious diseases is constantly evolving. Globalization, climate change, urbanization, and deforestation have created new opportunities for pathogens to spread, leading to the emergence of diseases in regions where they were previously unheard of. This has further emphasized the importance of global cooperation, surveillance, and rapid response strategies to contain the spread of new and old pathogens alike. Moreover, while scientific progress has made it possible to treat or even eradicate certain diseases, we must not become complacent. Diseases like smallpox have been eliminated through coordinated global efforts, but others like tuberculosis, malaria, and HIV/AIDS still pose significant threats, particularly in low and middle-income countries. Investment in healthcare infrastructure, research, and preventive measures must continue, especially in regions with limited access to medical resources. Preventing the next pandemic or controlling future outbreaks will require sustained efforts from governments, public health authorities, scientists, and individuals. Communities must be educated on the importance of vaccines, hygiene, and environmental sanitation. Governments and healthcare systems must be prepared to swiftly respond to outbreaks with quarantine measures, mass testing, and the distribution of vaccines and medications. Ultimately, controlling infectious diseases is not just a matter of medical intervention but also of addressing broader social, economic, and environmental factors. Poverty, lack of access to clean water and sanitation, malnutrition, and inadequate healthcare facilities make populations more vulnerable to infections. Strengthening healthcare systems, improving living conditions, and reducing inequalities are integral parts of the long-term solution to managing infectious diseases. In conclusion, the fight against infectious diseases is a dynamic and ongoing process that requires vigilance, innovation, and collaboration. While humanity has made great strides in understanding and controlling these diseases, emerging threats and evolving pathogens demand constant attention. By continuing to invest in research, public health strategies, and education, and by fostering global cooperation, we can reduce the burden of infectious diseases and protect future generations from their devastating impact. The war against these invisible enemies is far from over, but with dedication and collaboration, we are better equipped than ever to face the challenges they pose.